I am delighted to be here with you all today, and thank you for this opportunity. I'm pleased to present some new ideas for ways to finance and deliver long-term care on behalf of the Milken Institute. I'd like to acknowledge my co-authors, Jason Davis, Ariel Burstein, and Caroline Servat, for their assistance in preparing our paper. Next slide. Policymakers have tried and failed to solve the vexing problem of long-term care over the past few decades. Most recently, the Community Living Assistance Services and Supports Act, also known as the CLASS Act, was enacted as part of the Affordable Care Act in 2010, and then it was later repealed after actuaries determined it was financially unstable. Since then, a national dialogue to find a comprehensive solution has been practically non-existent. But the need has not gone away. In fact, it's become even more urgent. And I will argue that we cannot consider our longevity risk without considering our need for long-term care services and supports. By 2030, just 10 years away, 1 in 5 U.S. residents will be age 65 or older. 70% of them, that's 70, will require long-term care at some point in their lives. The public health crisis caused by COVID-19 exacerbates the well-documented workforce shortages, lack of sufficient funding, and vulnerabilities of those in need of long-term care. During the last 6 months of 2019, the Milken Institute's Center for the Future of Aging and Innovative Finance teams analyzed the most pressing barriers to effectively meeting the long-term care needs of Americans. We interviewed more than 50 stakeholders and subject matter experts from a wide variety of fields. While most respondents initially told us that the long-term care system was irrevocably broken and needed to be blown up to start over, when pressed, over 80% of interviewees came up with concrete ideas. Based on this feedback and other research, we developed 7 potential solutions to improve the current status of long-term care funding and delivery. This presentation focuses on 3 of the most promising approaches. Next slide, please. While many older adults will have decades of active, purposeful living, more than half will need a high degree of assistance with eating, bathing, or other routine daily activities. The aging of the baby boomers will double the number of Americans needing long-term care to 27 million by 2050. Long-term services and supports, or LTSS, refers to a wide range of services to help people live more independently by assisting with healthcare needs and activities of daily living. Those with serious illness, such as severe cognitive impairment like Alzheimer's disease, typically need more than 5 years of care. The costs are staggering. An annual nursing home stay averaged around $102,000 in 2019, or well over twice a middle-class family's income. Next slide, please. According to the U.S. Department of Health and Human Services, roughly 52% of LTSS costs are paid out of pocket for individuals aged 65 through death. Medicaid pays for around 34% of LTSS costs, primarily for low-income people or those who have spent down their financial assets to qualify for coverage. Private long-term care insurance pays for less than 3%. About half of people with long-term care needs live in the community, assisted by family and paid home care aides, and about half live in assisted living or nursing homes. Next slide, please. The experts we interviewed expressed optimism about 3 potential solutions. The first would increase the availability of affordable long-term care insurance by putting forward new types of products in both the public and private sectors. The second would turn to Medicare as a potential solution by allowing the program to cover more long-term services and supports. The third potential solution relies on technology as a means of improving cost savings and efficiency. Next slide. Over the last 2 decades, the private long-term care insurance program market has changed considerably. As this slide shows, it's plummeted from slightly more than 100 insurers in 2002 to about a dozen today. The market has declined due to faulty actuarial assumption models issued before the mid-2000s, which failed to predict interest rates accurately, mortality, lapse, and claims rates. In response to a declining market for traditional long-term care insurance products, insurers have been experimenting with hybrid policies that integrate existing benefits into life insurance or annuity products, often through a long-term care rider. According to the Society of Actuaries, in 2018, 85% of long-term care product sales were hybrid long-term care products. Next slide, please. We recommend 3 potential approaches to move forward. Health savings accounts, or HSAs, could be an important vehicle to fund long-term care insurance premiums. The tax benefits associated with HSAs are significant. Unfortunately, the premium structure of some hybrid policies make these ineligible for qualified HSA distributions. Current contribution limits impede their potential to fund long-term care. Several states have begun experimenting with new ways to fund long-term care. Generally, they've opted for one of 2 possible approaches. A front-end approach, which allows policyholders to have a short waiting period, but a limited benefit time frame, say 2 years. This is being tested in Washington State. Many other states, such as Minnesota and California, are considering proposals that would provide back-end catastrophic insurance. We encourage more state program experimentation to learn more about how consumers respond to both coverage options and payroll taxes to fund them. Finally, given the high cost of long-term care and the inherent risk for insurers active in the market, we believe creating a market similar to the catastrophic risk insurance market using cat bonds could provide critical funding if claims reach catastrophic levels. Providing additional forms of liquidity to insurance companies could, in turn, make the market more profitable and allow for increased flexibility in product design. Next slide, please. While some experts look to new product design and state-based approaches to boost long-term care insurance, others point to the health insurance industry for lessons on how to manage the risk and cost of insurance. Many experts noted that the long-term care insurance industry is way behind the health insurance industry in terms of using interventions to help manage costs. Medicare Advantage plans have increased in popularity as a way to hold down costs while providing additional benefits to enrollees. Enrollment in MA plans have nearly doubled over the last decade. In 2019, 34% of all Medicare beneficiaries were enrolled in Medicare Advantage plans. The Congressional Budget Office projects that MA plans will enroll nearly 50% of beneficiaries by 2029. In 2019, through the enactment of the Chronic Care Act, for the first time, MA plans can pay for services that are not primarily health-related as part of the supplemental benefits they offer. Next slide, please. While MA plans have been cautious about covering these new benefits, an analysis of publicly available data from the Centers for Medicare and Medicaid Services, or CMS, indicates that about 16% of all MA plans will be offering at least one of these new supplemental benefits, such as transportation and meal delivery, in 2020. We view this as an important step in the right direction and anticipate that in 2021, we'll see a robust baseline and distribution of benefits across markets, which will enable more reliable economic analysis in the future. Another promising approach is the ability to test and expand LTSS under a value-based insurance design model, which provides even more flexibility and is now operating in all 50 states. Finally, during the presidential Democratic primary campaign, there was increased emphasis on expanding Medicare for all Americans. In light of COVID-19, I expect these discussions to continue, especially as it relates to expanding coverage for LTSS. Next slide, please. Technology has incredible potential to fill a wide gap between the demand for and availability of services. LTSS requires high-touch intervention, but technology can help meet needs for those who cannot afford to pay for services or live in remote areas where access is limited. Health and long-term care insurance companies, as well as CMS, will play an essential role in adoption rates because many of these tools can be given or shared at a discount to participants to encourage use. We view this as a more effective distribution channel than a purely direct-to-consumer model. Telehealth use has increased significantly over the past decade. This slide shows a study of telehealth visits for privately insured and Medicare Advantage enrollees that found that annual telehealth visits increased 52% from 206 in 2005 to over 202,000 in 2017. Since COVID-19, Medicare relaxed its rules for paying for telehealth, and it has exploded in use. Health systems across the country have reported huge increases in the use of telehealth. For example, Intermountain Health Plan reported that prior to COVID-19, they had 100 telehealth visits per month. Now they have 10,000 per day. One of the biggest challenges in the past was getting patients to try telehealth. Now that we've let the genie out of the bottle, I believe it will be very hard to reinstate restrictions on telehealth, and it will provide enormous new potential to provide care in people's homes or in nursing homes and assisted living facilities, lowering costs for all. Next slide, please. To move forward, we need to pilot test technology in the long-term care sector that has worked in the health sector. In addition to telehealth, we also promote in our paper more testing of predictive analytics, remote monitoring, and assisted mobility in multiple locations across different settings. Over the past decade, the lack of interoperability, that is, the ability of different systems, devices, and applications to access, exchange, integrate, and cooperatively use data, has hampered efforts to allow information to be easily shared between doctors' offices, hospital settings, and long-term care facilities. Right after our paper was submitted, HHS released a final rule on interoperability on March 9th. The new rules focus on allowing patient access to health information, which could have positive implications for the ability of older adults and their families to better manage long-term conditions. Because they were not eligible for subsidies to pay for technology, long-term care and post-acute providers have been way behind in terms of adopting new technology. To jumpstart their participation and close the funding gap to support long-term care, we support establishing a federal-level business seed fund targeting aging-related technology companies modeled after the state grant for assistive technology program. We also recommend creating an impact investment fund to support the development of emerging technologies and scaling public-private subsidy programs for insurers and care providers to offer technology at low or no cost to users. Next slide, please. In summary, the ability to fund and deliver long-term care has reached crisis proportions in the U.S. We cannot afford to wait any longer to implement new solutions. While it seems unlikely that a comprehensive government-funded solution will emerge soon in light of slow economic growth in response to COVID-19, we have identified several solutions that can make a difference in the lives of millions of older Americans and their families. We encourage all of us from a variety of sectors and disciplines to work together to implement these proposed solutions. When we address longevity risk, we must consider your risk for needing LTSS. We hope these ideas stimulate discussions about public and private solutions to better prepare for this impending crisis. Thank you. I look forward to your questions.